What is ESRD and how is it treated? End-stage renal disease is a condition in which the kidney's function is reduced to 10% or less of normal ability. As an essential internal organ, the kidneys are responsible for fluid removal as well as regulating electrolytes such as calcium, phosphorus, and potassium through the blood and the urine. If the kidneys are not able to perform these functions, patients will acquire additional chronic conditions such as hypercalcemia, hyperphosphatemia, edema leading to congestive heart failure, and ultimately death. ESRD can be caused in a number of ways, such as being hereditary, traumatic injury, overdose, and autoimmune diseases, with hypertension and diabetes being the first and second leading causes. Although ultimately kidney transplant is the only cure for ESRD, there are patients who either won't qualify for a transplant due to age, underlying conditions, or the choice not to pursue transplant. It can take years for a patient that qualifies for a kidney transplant to become a recipient either from a living or cadaver donor. Therefore, hemodialysis, a therapy that performs about 15% of normal kidney function through osmosis and diffusion filtering systems, is available to prolong the patient's life. Upon diagnosis of ESRD, patients are generally prescribed hemodialysis treatment 3 times per week for 3 to 4 hours per session, in addition to a number of medications. Strict adherence to treatment is required, and noncompliance can lead to chronic hospitalization and death. This is where managed care disease management comes into play. Legislation leading to Medicare coverage for renal failure treatment. According to CMS.gov, renal failure is the 9th leading cause of death in the United States, with over 500,000 patients receiving treatment in 2017 alone. Without dialysis, a diagnosis of ESRD will lead to death in a very short time. Treatments and medications can cost upwards of $72,000 annually per patient. For these reasons, through congressional legislation, the Social Security Amendment of 1972 enacted authorization for Medicare to cover dialysis treatment for patients presenting with renal failure. According to Medicare.gov, any person who has been diagnosed with renal failure and has paid into the Medicare program through income taxes or as a spouse or dependent of a person who meets these requirements is eligible for insurance through Medicare to pay for services pertaining to renal failure. In order to receive the full benefits of Medicare coverage, the patient must be insured by both Medicare Part A and B, as well as obtain prescription drug coverage through Medicare Part D. Upon being accepted into the Medicare program, coverage for dialysis treatment starts on the first day of the 4th month of therapy, with the insurer paying for 80% of the fees. CMS guidelines for disease management and renal care. The Center for Medicare and Medicaid Services requires ESRD patients to have a treatment plan upon admission to a dialysis clinic, 90 days into treatment, annually, and as needed if they are deemed unstable. The treatment plan is comprised of areas of focus, personal goals, and how the team will intervene in order to meet these goals. Examples of what elements of the patient's fitness evaluated are: is the dialysis access functioning properly, and if they are receiving adequate treatment, if they are a fall risk, when was their last hospitalization and why, if their blood pressure, anemia, albumin, fluid intake, and body mass index are being properly managed, treatment compliant, and behavioral concerns. Additionally, if their transplant status and advance directives upon death are in order. CMS sets reimbursement for treatment guidelines on the overall clinical population as opposed to the individual outcomes. CMS